Melanie? There we go. Okay, thank you, everybody. Appreciate everybody coming in for our daily briefing. I want to thank Dr. Gupta, who you'll hear from. Dr. Thomas from Upstate is here as well, who you'll hear from. Emergency Management Commissioner Dan Weirs, I want to thank him as well. He is here. Deputy County Executive Ann Rooney, and members of the media. Thank you. You've been busy. We've seen a lot of each other. Okay, let's break down new data, and then we'll get into a couple other things. We have a new map up that I believe we have up somewhere. Where's the map? Okay, put the map up. We got 53 total cases, up from 45 yesterday. 7 of the new cases are individual cases. 1 is a contact case, which is a case that an individual was under a quarantine. So overall, we have 46 specific cases, 7 contacts that are positive from quarantines. Just to remind the public again, when we put people in a quarantine, there is a higher probability that they will test positive than just someone who shows up due to a doctor referral. Let's break down who the individuals are as far as some background, not specifically who they are. 28 of these individuals are female, 25 are male. We have, 22 individuals are under 40. That means 42% of our cases are under 40. That is a number that actually has increased from yesterday. I know one of the stereotypes often was that those under 40 in their 30s and 20s are invincible to this. Not the case. Looking at that, we have 12 in their 20s, 7 in their 30s, 8 in their 40s, 8 in their 50s, 7 in their 60s, 7 in their 70s, and 1 in their 80s. So 57% of our current cases are under 50 years old. Another data point, 15% of our cases are over 70. We have 140 people in mandatory isolation and quarantine at this point. That's a moving target. As we identify positives, we'll have more people after our health department does an investigation going into quarantine. At some point, people will be coming out of quarantine. So that is a moving target as well. Let's break this down by geography. City of Syracuse, 18. Salina, 8. I had someone email me saying, hey, the town of Salina is a big place, different neighborhoods. We are not going to be breaking down by neighborhood. That gets too close to reporting on who identities of people may be. Clay, 6. Cicero, 4. Onondaga, 4. Camillus, 3. Manlius, 3. Skaneateles, 3. Lysander, 2. Pompey, 2. What does all this mean? We have been one of the early communities that began testing. Our doctors wanted us testing. We started a triage testing site early on before we have a positive case of COVID-19. We've done robust testing. We've done more testing here than many other upstate communities. Because of that, we're getting back positives, and we knew we would. We will see more positives over the next few days as some of our robust testing days from last week are going to be coming in later today and tomorrow. So we're going to see numbers go up, but that's good. This is what we need to have happen. We need to know who's sick so they can get help. We need to know that the health department does their investigation so that they can understand who needs to be in a quarantine. So we do that. There's been a lot of social distancing policies that have been implemented as well to really help bend the curve here. So we're excited about this. Today is not one of the spikes we saw yesterday or the day before, but certainly we have more testing coming in. Before I get into some specifics on testing, I'm going to let some of our other speakers come up to just give some facts on the ground that they're seeing. But we did let all of you know that if there was a case where there is a gap in our investigation, we would alert the public and ask the public for help. Certainly last week we talked about the America's Best contacts and eyeglasses. We gave times that we needed help from the public if they were there. today we are doing a similar situation with a case, okay? So this is what we are asking the public. If you visited a Shodi's Meat Market between 12:30 and 4 p.m. on Tuesday, St. Patrick's Day, please contact our health department and or please contact your primary care physician. Okay? I hope we're not raising hands yet from the press corps. But so again, between 12:30 and 4, Tuesday, March 17th, St. Patrick's Day, last week, if you went to a Shodi's, we would like to hear from you, or we want you to contact your primary care provider. Okay, at this time, I want to introduce Dr. Gupta. Dr. Gupta is going to talk about case investigations and the process. Okay. Doctor?
Thank you. I'm short here, so I have to put this stool. Good afternoon, and as County Executive has mentioned, I just wanted to make sure that the directive, which is we are asking public to look for the Shodi meat market in Solway, is because if they are, especially they're elderly, if they are have immunocompromised system, that is something very important. We want to make sure that they contact their physician if they have any symptoms. If you are feeling fine, that's great. That does not mean you visited that you will have symptoms. We're just trying to be very proactive about that. So just to, as you saw that we have 53 cases now, and they're in all different age groups. What, as a health department, we do active surveillance by identifying cases which are coming from our doctor's office. When there is a COVID positive case, we have talked about that before. I just wanted to go over one more time. So when we get that report back from the lab, or the doctor sometimes calls us also, either way, it works out. Most of the time we started to see those. We will contact the patient after they have been contacted by their primary care physician. If they do not have the primary care physician, we certainly will go ahead and contact them. Our staff goes through the very thorough interview in terms of what was the date of onset, what were the symptoms, and where did they visit? Who are the people who they contacted at that time? It is so important. How many people are living in the households? Everything is very important for us to give the directive further in terms of isolation and quarantine. Because those individuals who are considered close contact are going to be put in isolation and quarantine for 14 days. It means no outside. I mean, outside will be outside of their house or something within their territory, but no grocery shopping, no social interaction in physical ways, except they can use that electronic tools to make sure they are connected. When we say that, we have to really be making sure that they are able to live through those 14 days by having food and whatever their needs are, medications or anything which they need, including mental health. So that's the part which we do. Then the contact of cases, we contact each one of them. So let's say there's a one case, we identify their 4 members. They're going to be all isolated with the family. And then we'll have to make sure, do they have enough bedrooms or no? If that's the case, if they are not enough shelter there, we'll have to find some other place there. So far, we have not seen that. So far, we have been fortunate, but it may come. And then we go to their friends and family and then try to find them in the community where they have, and also locate them into their trajectory, whether they went to grocery shopping, whether they went to the hospital, because healthcare system is a very important part of that. We have to really make sure that healthcare workers stay protected. One other part I want to talk about just briefly is that if you test negative, it's great that you test negative, but that's in that time. I think it's important for people to think about that. It's not a free ride, just go ahead and do anything you want to do. It means you are doing good, you did not turn positive, but it means you continue to do social distancing, personal protective measures, as well as the environmental cleaning and everything which you're supposed to do. The one other part which we will continue to look into that, and I think you have sometimes asked, are these cases linked to each other? This is something we are actively looking onto that. First part is looking into that, how many one case had become another case. These contacts become cases, as County Executive has mentioned. Few of them have, but not. A lot of them we are seeing new cases at this point. But is there any connectivity among all? That's what will be work in progress. So I do believe that if we continue to work together, certainly we'll be able to get behind this. So thank you.
Thanks, Doctor. Perfect. I'll go over a little more data, and then we'll bring up Dr. Thomas to give an update on the hospital infrastructure. Testing, okay? A lot of questions on testing, okay? And a lot of the same questions every day. So let me try to get this right so that I don't answer the same questions over and over again, although I will answer them again if you need me to. Right now, 1177 back, 53 positive. 4.5% is the number. That percentage went down from yesterday. So we anticipate, to remind everybody about how the testing is done, the upstate, if you're getting a test at upstate, I believe you're still using the Wadsworth lab. They're going to Wadsworth. Wadsworth is very busy. They may be getting them back in 24 hours, 48 hours, 36 hours. We give averages, okay? That doesn't mean that it's, written in stone. Kraus has their own partner. The primary care providers have their own partner. Certainly, the triage testing site has been using Quest. Quest, it uses 2 labs. Okay, they use a lab in Virginia and a lab in Pittsburgh. Right now, the results from Pittsburgh are coming back faster than the lab in Virginia. They tell us that that's going to be fixed by the next 24 hours. So overall, on average, a test in this community comes back between 3 and 5 days. I know many have sent me emails. Remind you, if you got it last Monday and you went in at 4 o'clock to get a test, that needs to get processed and then sent out. That may have not gotten out till Tuesday, right? So on average, 3 to 5. Due to Quest's, depending on the lab that they got sent to, it may be another day. So to remind everybody, we have an executive order. If you take a test, there is a reason why you took a test, not because you wanted to, but because a doctor thought that you were symptomatic of flu-like symptoms and COVID-19 had to be ruled out. So it is your responsibility by law to be under a quarantine situation. Because we know this is an inconvenience for you, we then have our helpline if you need help related to groceries, mental health, anything else. And our helpline is 315-218-1987, where we're here to help you. If you're in a quarantine, you didn't do anything wrong. You either had contact with somebody or you got tested because you're sick. We're here to help you get through that period of time. And then if you need to be in a longer quarantine, get through that period of time. So I think that's important. Also related to this, we know we're going to be receiving an abundance of testing over the next 24 to 36, 48 hours. So we'll have more results tomorrow. There will be more positives. The idea about that Dr. Gupta touched on related to investigations. Think about how many new cases we have, and think about the investigations that need to go in immediately to identify those at risk of being in close contact for a quarantine. The second piece of those investigations is just what Dr. Gupta talked about. What correlations are between the existing positive cases, not someone who is a family member or a spouse or a significant other. That's obvious. If you're living in the same house and you're sleeping in the same bed, you're going to be in a quarantine. But what other ways were these potentially related? We know in our community we have travel-related and we have community spread. At some point, this virus came in from somewhere, but it is now here. So saying that, let's go over the upstate triage line real quick, then we're going to hear from upstate. We've had over 5,700 calls for assistance. This is key to flattening the curve. In addition to that, the Microsoft Upstate coronavirus assessment tool has had over 21,000 clicks to look at the algorithm and utilize that technology when assessing one's health. We want to thank Upstate and we want to thank Microsoft for that. Again, this helps keep the emergency rooms and the hospitals' infrastructure intact so that they're serving the sick that needs to be there in real time. Saying that, I'm going to ask Dr. Stephen Thomas to come up and give an update related to what they're seeing at upstate right now. Doctor?
Thank you. Good afternoon. So I'm only speaking for upstate today. I'm not speaking for any of the other hospitals. I'll talk about 3 topics. The first will be current hospital capacity. The second will be status of PPE, and the third will be status of testing. So in terms of the number of beds, so medical surgical beds that we have available, the number of intensive care unit beds that we have available, staffing, and ventilators, we're green. So today we're in good shape. We're in good shape by design because we made a lot of tough decisions about elective surgical procedures, moving to telehealth, trying to manage people in the outpatient setting virtually. So this is where we are today, and we're in a good position. In terms of testing, as the county executive said, we continue to see people, we continue to swab people, and we continue to send tests to Wadsworth. As was mentioned, the turnaround time on testing is anywhere between 24 to 36 hours. And considering the amount of volume that Wadsworth is doing just from our hospital alone, I think that they should be commended for the work that they're doing. And then the third would be PPE. So when I'm talking about PPE, gowns, gloves, masks, respirators, we're also green in that area today. I make sure that everyone knows that I'm talking about today because that situation can be very volatile and that situation can change. I can tell you that we're working with the county and we're working with the state diligently to try and increase our stores of PPE. But if you read the papers and watch the TV, you know that PPE is difficult to come by these days. So we're trying to be very innovative in that way. And that's the update.
Thanks, Doctor. All right. Couple good trends related to testing. At our triage site, we've had 3 straight days of declines. That's not because there was tests not available. Tests were available, but it's because for whatever reason there's declines. We'll see what happens today. But if the data continues to go that way, our hope is that people who are symptomatic with respiratory illness are getting tested. And we're getting to the point where we've started to get ahead of all those cases within our community. From a social distancing standpoint, we are no longer getting funny emails in our inboxes, but we are getting things forwarded to us related to really what is some crazy ideas going on in neighborhoods throughout our community. I appreciate the need for happy hour. We encourage happy hour for mental health for adults when doing it responsibly, but we should not see posts on Facebook of adults having happy hour and practicing social distancing, and then at the same time in the background having their kids playing together all over each other. It defeats the purpose. We might as well have kids in school if that's how we're going to behave. So we really need parents to step up and take advantage of this time and take this seriously. Your kids should be really within your own property lines. They should not be really being put in front of senior citizens at this point, and we really need you to be partners on this. We've talked about every day the economic pain, and many of you are emailing us talking about that economic pain that is becoming a reality. The fastest way we get to normal is by implementing these social distancing policies, and that means not letting our children go on play dates. So please take that seriously. We really need our parents to step up related to this. Again, we talked about spring breakers coming back. Our advice to spring breakers coming back from out of town is put yourself in a quarantine. That's going to be our advice, and we believe that's what you should do coming back from spring break. I'm pleased that Syracuse University has been doing patrols on off-campus housing, so I want to thank Syracuse University for doing that. That's really important. Certainly when we're related to mental health, we have our mental health support line with 211. This is going to be tough as each day goes on when folks are at home, and when you go out, you're going out by yourself to go to the grocery store or the pharmacy or an essential business. It's not going to get easy. If you need help, call 211. talk to somebody. This is a service here for folks to really take advantage of. Mental health will be a big piece of this, certainly as we get into the next few weeks moving forward. Our senior first responder, adult nutrition, and now we've opened it up to our healthcare worker hotline is there to help anybody who has needs. Please take advantage of that. We've had over 1,100 nutrition requests from the public. These are all individuals that are a new group of our of vulnerable people in our community. These are independent seniors, essentially, healthcare workers who are on the front lines every day that maybe can't get something they need, or they can't get to the grocery store after work, or they're getting to the grocery store and what they needed wasn't there. Related to that, I had another conference call today with our grocery store companies. Their food supply chain is intact. They were very busy this past week, but not as busy as the week before. So we should start seeing that at the grocery stores from a supply standpoint, they told me, and we'll continue to have calls. Daycare, we have over 1,900 slots available. This daycare is available for any essential businesses, healthcare providers, emergency management, and or emergency providers. Right now, we have worked this out where if you have a daycare emergency, this will be free of charge for this period of time. So I want to thank that. Donation of goods. One of the great things about our community is people are rallying right now. We're seeing a lot of innovative ideas about dealing with the PPE issue that we have for our supply chain. But we're getting a lot of people who want to know how they have this, they can help, they want to donate something. So certainly we want to streamline this. I'm asking you that all PPE donations be directed to the following website, emweb01@ongov.net. Again, that is emweb, Emergency Management Web 01@ongov.net, or you can call us at 315-435-2525. Donations can include N95 masks, standard surgical masks, nail salon masks, surgical gowns and gloves, eye protection, and, of course, hand sanitizer. So those, I think, are important. I got a lot of questions about supply chain yesterday. We're happy to report that the county has secured 60 ventilators, and part of our planning for potential surge capacity in our hospital with ICU beds off campus in the event that we had our ICU beds strained in our hospitals. We're working on those plans. We'll talk about those either tomorrow or Wednesday, but we have secured 60 ventilators, which is something that Onondaga County has not had to do in a long time because we don't own a hospital and we don't run a nursing home. Saying that, questions? We are utilizing various broker networks. Michael, this is a situation where we're not going to give away our supply chains right now because it is that competitive. And the more people that find out about supply chains at this point, you'll have a price at the beginning of the day. And then when you're trying to execute on that price at the end of the day, your price doubled in many cases. So right now, I spoke to the state earlier today. They're going to be contacting us about giving us some relief about some of our N95s and our PPE. We don't believe ventilators will be coming our way right now because we have the capacity we have right now. But we were planning in advance, so we're not going to give away specific supply chain efforts right now because we don't want those to dry up.
Why the town-by-town breakdown?
Other community.
People all over Salina and other towns who say that automatically feeds the question, well, what street? Is it my neighborhood?
Yeah.
When I talked to Dr. Gupta a week and a half ago, she was in the mindset of erring on limiting information because of the idea that panic will set in. So what good is a town-by-town?
Two reasons. One, to get away from the stigma that this isn't in my community, okay, and to take the social distancing serious. Two, other governments are giving out the same information to their media outlets, so we're going to reciprocate.
Ryan, yesterday you mentioned corner stores and possible gatherings outside. You said maybe you'd send over law enforcement. Have you had to do it with them specifically, or have you sent the sheriff's deputies anywhere yet about social distancing issues?
We got a couple tips earlier that were concerning, that we thought the behavior was reckless. The sheriffs, if true, the behavior is reckless. The sheriffs were going to drive by those locations. I don't know if it was actually happening or not. Certainly, one of my requests yesterday, Andrew, was for snow, and we got some snow. So that's a very good deterrent, and it's a very good friend of social distancing. So we're going to have some wet snow weather this week. That's going to help us bend the curve. Tim?
That's 60 ventilators on top of how many in the community now? And could Dr. Thomas talk a little bit more about how much capacity we have before it's exhausted?
Yeah, I'll let Dr. Thomas talk about that. An inventory is being done with hospitals on how many are in the community. I don't know if we have that number yet, but Dr. Thomas, do you want to come up and talk about that?
So I'm not being evasive, but that's a constantly changing number because on any single day we are discharging 50 to 80 patients routinely. So the number of available beds on the medical surgical side, on the intensive care unit side, is constantly changing. You know, what I can say is, again, the idea that we stopped elective surgeries, the idea that we're doing a lot of medical visits virtually has freed up beds. So again, today we're green. I'm hoping tomorrow and the rest of the week will be green. I can't speak to what we're going to be like next week.
Are we at about normal, if there is such a thing, right now?
We're better than normal because, again, a lot of these elective surgeries and other procedures that would require an inpatient hospital bed, those have been delayed when they can have been delayed. And these are decisions that physicians and patients are making together of what can and cannot be delayed.
I don't believe so. Michael, we take that very seriously, and everybody, most people get it. They want to get help. They don't feel well. The people who are in quarantine have a level of fear that they're going to test positive. So for the most part, people have been really working with us and working with Dr. Gupta and her team. And they need to, because there's a lot of work. We did robust testing. We're getting all these results back very quickly. Erie County, I believe their test results are half of what we've gotten back, a community bigger than ours, right? So not every community in upstate New York had the infrastructure in place that we did, and so we're a little bit ahead of everybody related to that. So Dr. Gupta's team is very busy now as we get new tests in every day, and certainly we need the community to be respectful of that. And certainly we have zero tolerance for anybody in a mandatory quarantine or mandatory isolation that's not going to respect the law. That's what it is at this point, the law.
We're hearing from people who say they're waiting a week for their results.
Yeah.
If that's the case, and I have no reason to believe that it's not, who's lying about that? What should these people do? Should they call someone? Is there a way of...
Yeah. So Michael, there's no way that they've been waiting 7 business days, because we started the testing Monday, and here we are. I think it's Monday. So here we are again. You're talking the 6th business day, maybe the 5th, depending on Monday. Part of the challenge at the triage site is that if your test was Monday and it went to Quest, sent it to the Virginia lab, they're a little backed up there. That's what we just talked about earlier. If it went to the Pittsburgh lab, you've gotten your results back already. So that's some of the backlog was related to our triage site, where the results went to get processed, and that is something that we've been told will be taken care of by the end of business tomorrow.
If the delay though is if it's 5 days till you get tests, and it's probably several days while someone is contagious before they come in for tests, it is a long running start before you get a result back. Do you feel like that's enough to stay ahead of the disease like you've tried to do with testing? Can that get shortened? Can we send tests all to Wadsworth?
No, the answer is no, we can't. So everybody has their own partner. All these partners aren't just doing testing for our community. There's thousands of tests being done every day. So certainly this is a lot of this is infrastructure being built as you go. You find a new partner that has new turn times, you utilize that partner. But related to staying ahead of the curve, I get it, Tim, but that's why we put in our executive order saying if you get tested, there's good reason to believe that you could have this, stay home. It's the law. So from the standpoint of a community spread, that's why we did that. It is inconveniencing people a little bit longer. We get that. That's why we have help to help them with our line. But at the end of the day, we're in this together as a community. We're all being inconvenienced. It's hitting us in our individual lives different ways every day, and that's frustrating. And we see that at times. We see that with phone calls. We see that with emails. But we got to realize that there's people in other parts of the state and other parts of the country that are sick and want to be tested because their doctor's telling them to, and they can't get a test. Okay? People are getting tested here. We're just waiting to get the results back.
Just to follow up on that idea, you've mentioned in the past the health department has about 20 investigators to follow up with people. Are they getting backed up now that more cases are coming and they have to try to trace out more?
Yeah, we've been training others to help do that. Do you want to answer that question, Doctor?
So we have actually many nurses who we continue to train now, who were doing home visiting from our different programs. So at this point, we actually have enough staff. However, if we have case continue to do, we have been provided some connectivity from our local hospital system that they will be able to offer some of their staff. So it's a very collaborative community. I do not think there should be a problem. People are very willing to do that. We'll just have to continue to train them because it's kind of very specific way the investigation is done. It's like you find one person, you have multiple trees coming, like multiple arms are coming out, and you have to contact every person and make sure nothing is left out. So we are in a process because we have to continue over the weekend too, like we work throughout, over the weekend, and we'll continue to do so until we have decline in cases.
About how many investigators do you have now?
So I just have to, because we keep on increasing, I don't have exact count right now. We certainly can get back to you. I can see all their faces right now, but I don't have really exactly number, honestly. And we'll get back to you about that.
Can you explain the process, not the training process for those folks, but what process they follow in making contact with an individual? Let's take the Ashodi's case or the case at America's Best
Right.
from last week.
Right.
How do they work? You mentioned it goes like a tree.
Right.
How does that work actually done?
So let's say you are COVID positive, and I'm calling you, right? I'll say, hi, Michael. How are you doing, this and that? We found your test. By the time your doctor has already contacted you, hopefully. If you don't have a doctor, then we will be the first one, and we kind of take your... It's a lot of times a shock to people. They feel like, oh, my God, I'm positive, even though they might be expecting that. And then we go through the sets of questions. When was your onset of symptom? Which day did you become symptomatic? And then after that, we have them track their path. How many people were in the family? Were they there? What did they go out for dinner? Did they go to the place of work or place of worship, or any restaurant or any concerts? So everything just feeds into. Basically, we are asking them to relive their life. Right? Make sense? Right. It does. So we give them time. We just go back and ask them. Usually what I tell primary care provider, which we have been talking to them, is when you're giving your first information to the patient, that time, give them something to think about, that the health department is going to contact you, and we want you to start thinking, where were your touch points throughout that? So it gives them a little time by the time we contact them, and you'll be surprised. People are very good, and sometimes when they're elderly, that takes a little time, so we have to have several phone calls to them. Then we have to connect with their family member. We go back. So that's a very tedious process. It's really every step of the way we have to make sure we are getting correct information. Then we congregate and we actually go through the case review. and try to see, okay, was this missing piece or this was missing piece, go back and find that information. So until we are all satisfied, we continue to find all the contacts and put them in quarantine.
Do you worry about running out of people to do this?
Well, yes and no. I mean, it's a reality. Is that something if we'll have? I believe our community has really very highly skilled professionals, and we will continue to have the supply chain from the health professional who are willing, either our staff or even volunteers. I have many of my physicians who want to volunteer here also, right? So we said, if you want us to do something, in my past life, I used to practice, so I know few people around, and it does make a difference, so it feels good. And I think we'll continue to do that. One thing I just wanted to, when you asked County Executive that question, it just occurred to me. When we have small numbers, we don't want to disclose that because that actually creates stigma in the township. When we have larger number, then people need to think about, it's here. It's not over there in Westchester, it's not here, it's here. So we actually go and then answer that. So I just wanted to make sure.
But the town-by-town breakdown then is, in your estimation, informative, but it's also, to some degree, a tactic to make sure people realize that no one is immune. Is that,
Yeah, if you're,
is that why this is, I'm just trying to drill down.
yeah, Michael, I think you're hitting on that. It is two reasons. One, nobody's immune. And for parents who are trying to have recess parties in their neighborhood, and some of these same towns, hopefully they're watching, people in your town have this. And they got this in probably a very innocent community spread. But by having children congregate and you congregate when we're telling you not to do that, it's a bad idea. It does. It really does. If you're sick, you need to stay home. That was where we started with this. And as you go through these investigations, you'll find people that didn't take that simple advice. And then the second advice is, we know the only way right now to get and stay ahead of the curve is to test, investigate, quarantine, social distance. When somebody in the community chooses that they're above that process, we will be in this process longer than we need to be.
Ryan, I spoke to a doctor today, and I'll run some of his interview, I think, tomorrow. You already hit on the kind of the hub for donations. Over the weekend, though, he went to the county's website to sign up to be a doctor on standby if we get to that point. He also wants to donate actual office, supplies in his medical office. So 2 questions for you and maybe Dr. Gupta also. What's that building list look like of physicians that have stepped up and said, if you need me, I'm here? And if you have a serious offer of medical supply donations, should they also work through that clearinghouse?
Yeah. So emweb01@ongov.net or 435-2525 is where we want any physician who was doing elective surgeries. Now they're not. They have materials. We've talked to many different groups that do elective surgeries. They might have one ventilator, respirator that they said, hey, if you need it, you can have it. Hopefully we don't ever need those. But certainly Dr. Gupta's team in our health department have a network of over 300 volunteers. And I'll give you an example about where they get plugged in. Dr. Gupta and Dr. Kwok are doing a lot of on-call calls with our positive cases. If their symptoms are changing, they're nervous about something they want to call, they've been calling Dr. Gupta or our medical director, Dr. Kwok. That's a lot. When she's doing everything she's doing, he's doing everything he's doing, we've plugged in some of those other doctors to take on-call calls. These are all things, when you have the robust system we have here, you can see how we're ahead of it and how effectively we're fighting it. Imagine if we're a rural community that has, if they have a small hospital, they have 1 or 2 primary care providers, they don't have that network. You can see how hard this could be for other communities. We're very lucky to have this infrastructure, and that's why, to Michael's point, it gets frustrating when we are putting in these measures in place to protect the public and the public doesn't take it seriously. And I think overall, everybody's taking it seriously for the most part, but you have some blatant situations where these individuals know better and they refuse to change their behavior when that's exactly what we need everybody to do.
Is there any kind of government order you could put into place that requires people to social distance?
It's already in place, right? So I think from an enforcement standpoint, we can't police every household. It's impossible. So if we get a tip to something that is blatantly out of compliance, that we want to send a message, we're going to send out our partners to go break those things up, sending a message to those community members. We need you to do better.
What's the good news today?
Look, we got some good news. I got 60 ventilators I hope we'll never need, and we got a lot of snow. So that's the good news. Tim?
You mentioned Ashodes. Is there any special response in response to the case at the VA hospital?
I'll let Dr. Gupta talk about it. I think there's a process when hospitals have something. They have their infectious control departments do an investigation as well. But if Dr. Gupta, if there's anything more you want to add related to the VA case, certainly it's a situation where we're comfortable with the individuals who are quarantined.
Can you repeat the question?
Well, there was a case of a worker at the VA hospital. I'm just wondering how much more we know about how long, how extensively he was at the hospital before he or she was diagnosed.
So, first of all, we never disclose the details. You know that. We say the same thing. The main thing will be to protect the workers and community. At this point, we have connectivity with the VA, but there is nothing that I am aware at this point that there are widespread problems anywhere. So that's the answer I can give it to you at this point.
Doctor, while you're at the podium, would you speak to the physicians who have signed up on the website to perhaps be on standby if and when you need them?
Right. I mean, the thing is, I think most of it, this is a call to action for my colleagues in the community. Not only when they want to volunteer, but when also what I would like them to be there for their patient, which they are, because their patients are scared right now. So even though they may or may not have COVID-19, they may have some other things going on, they need you. They need you to take care of them and just have a compassionate hand out to them, essentially. It's important. Just a phone call with the telemedicine, I think a lot of practices are doing it. So their role is a lot crucial to be there for those patients, because people still have heart attack, people still have asthma problems or diabetes problems, and we don't want them to get caught up in the COVID-19 and next thing they are not taking care of their daily needs and not eating well and getting depressed. So yes, if we need them, certainly we will utilize them, and I'm proud to be representing that community, but at the same time, their patient, they are there. I think they are going to continue to do that. So,
do the cloth masks that people are making at home work? Would those go to a hospital, or are those more grassroots, maybe people at home would use them to go grocery shopping?
Say it again, for the mask?
Yeah, we see people making cloth masks.
I don't know. I mean, Dr. Thomas might have much more infectious disease thing.
Can you use them, doctor?
I don't know.
Or they got to be certified, I think, for you to use them? You want to? Yeah, come on.
So Upstate is getting a lot of different groups that are reaching out to see if they can help us with our PPE needs, and some of them are very innovative solutions. So we have a process by which there's a single point of entry to receive those requests, and then we have a vetting process. So it has to go through our logistics and supply people, it has to go through our environmental services people, and it has to go through our infection control and our clinicians before we're going to sign off on any of that.
And while you're at the podium, I talked to Mayor Walsh last week about the status of Upstate processing tests. I'm not sure that's the technical word, but actually turning around test results in Syracuse, calling from there positive.
So right now, Upstate is actively processing samples to send to Wadsworth to get the testing done. It has always been our goal to have a testing capability in Syracuse. And if you follow the lay press, you see that there are a number of different diagnostic manufacturers that are coming online, getting their emergency use authorization approvals. We have multiple lines in the water to try and see which tests we can adopt when they're made available to us. Just like PPE, the queue is really long. But we are working very hard, and we're lucky to have the government that we have, because they're working on our behalf to try and get these capabilities in-house at Upstate. We do it for many different tests. We can do it for this. It's just a matter of us getting the materials we need, getting the panels that we need to get authorized to do the testing, and then to do the testing. I'm optimistic we're gonna have it here. We don't have it today.
Would that be a game changer for this community?
In my opinion, absolutely. Because you imagine if you can get a test turned around in a couple of hours, what that means for people at home in terms of their ability to have to quarantine/isolate, the ability for us to stop burning PPE in the hospital, the ability for us to strategically place patients in different parts of the hospital, it would be a game changer.
That was Thursday. I asked the mayor. We're several days later now. Any hope, any timeline, anything anyone can do, since you can speak to the world right now?
I'm a physician, so I always have hope. So yes, my optimism is measured, but I'm still optimistic.
Yep. Yep. Related to a business that should be shut down today? Yeah, we would have to look at what the penalty would be. If we were alerted of one, we would have our law department call them first. And second, if we felt that wasn't being taken seriously, we would send out the sheriffs.
Have you had any complaints to that?
We're getting so many emails and so many calls that related to that specifically. I'm not quite sure, but certainly we're getting a lot of communication, a lot of questions about what it means, a lot of confusion as to what is essential and not essential, more of the things that people would not necessarily deem as essential, but it is essential, asking me why. Someone emailed me, asked me why I extended the April 15th tax deadline. They want to get their refund check. I told them that I am not the IRS nor the president. It was not me, but they could still file and get their refund check if they wanted to. So we're getting a lot of communication right now, and we encourage that to continue to happen.
Do you have enough test kits for the rest of the week, or
Yeah.
for a day, or?
Yeah, we're comfortable right now with test kits. We've seen a trend right now where it's been downward. We'll see how that holds up. Today's a big day with that because we have 3 straight downward days. It's Monday, so maybe that's an uptick. But we have, I would say, we're comfortable at least through midweek.
Where are you getting them from?
Again, we're not going to divulge our supply chain for the sake that we want to continue to have that supply chain available for us.
What are those? Do you have those numbers on hand? The 3 days of downward numbers.
I think we went from high of almost 300 on Wednesday down to high 2s on Thursday, and then Friday was about $1.76. Saturday was around 100, and I think Sunday was a little bit under 100 at the triage testing site. So it's Monday. Those numbers will probably jump up a little bit, but the more data we get, this helps us tell a little bit of a story. And our hope is that because we have the testing, that anybody who's symptomatic, where we're getting a grip on them, and then we're quarantining, and then we're stopping those potential infections, and then by social distancing, we're able to starve the virus out. And if we continue to do this for an extended period of time, we're going to be in a good spot. But it's when we don't play by the rules that you put a lot of that in jeopardy, and that cycle starts all over again.
What's the total number of tests to date?
To date, Tim, I'd have to go and look at that. We've had, I think, over 2,000 tests in the community. Last week, at one point, it was very robust each day. It's had slowed down. But certainly, we anticipate that the 2 largest testing days at the triage testing site, most of those are starting to come in today and by the end of tomorrow. So we'll have lots of new results tomorrow.
To either doctor, are the symptoms of local patients matching the national, list of symptoms? I know, digestive issues is kind of a new addition to the symptoms. Locally, are we seeing a mix of things? Anything specific, Doctor?
Yeah, I mean, the symptoms vary. You see in the hospital it's the same thing, and digestive symptoms have been there in the past, so it's not something new because it's locally now, so we are noticing it more. Some people have minimal symptoms, some people have quite significant symptoms, depending on which age group, what underlying condition, all these things do matter.
How many hospitalizations? Was it up
4?
from 4
No,
still?
5.
We have 5 hospitalizations
5, okay.
at this point.
And 1 in critical?
4
So
good.
2 critical we have, and 3 is good. I'm using your word today.
Ryan, does the state fairgrounds factor into your planning for surge sites?
Yeah, not right now, Tim. I think we have a couple really good options for a surge ICU hospital in the event we were going to need one. And I think when you look at additional testing, essentially the Syracuse Community Health Center has turned into a mobile testing site. So we're able to meet all of our demands right now. So I think from testing sites, we're in good shape. We got plan. We can have the ability to add on to that quite quickly. We already have everything in place, but right now it's not an issue. There's hundreds of tests pending. I think we probably have 500, 600, 500 to 800 tests probably collectively between everybody that those results are pending at some point in the process. We'll see a big chunk of those, we believe, tomorrow.
How quickly is Quest? It sounds like the Virginia site's been delayed.
Yeah.
To up to 6 days, maybe. Or
Yeah.
What are they promising to turn it into?
We're supposed to see our Virginia results by the end of tomorrow, is what we're being told.
So 3 to 5 days is still going to be the.
Yeah, I think some of the Pittsburgh stuff's coming back a little quicker, but we're gonna stick with 3 to 5 days until we see, steady performance under that. New York State Department of Health guidelines. Yep.
Ryan, you mentioned it's kind of competitive out there for supplies.
Yeah.
And do you feel like you're working in concert with the other counties and that everyone's doing the same thing, or is everyone kind of on their own?
I think everybody to a degree has a responsibility to your community that you're serving to try to get supply chain. We are unique because we are a community that has Upstate Hospital. I get a lot of emails about this, so let me clarify this. Upstate Hospital is called Upstate because it's a state-funded hospital in upstate New York, which has many counties. The doctors at Upstate treat patients from all over upstate New York. So a lot of the materials we've gotten from the state when the state was short was because we have Upstate here. They brought us those materials because they know they're not only treating people in our county, they're treating others. So to a degree, the supply chain was very tight. I think the governor talked earlier about it getting a little bit better. And I talked to the governor's office today. I think as far as N95s and PPEs, I think we're going to get a shipment in from them. We've been identifying our own supply chains. Many of these supply chains are interesting. Foreign countries, a lot of qualification needs to go into that process before you get too excited. And certainly, I know that other communities have run out of testing to the west of us, specifically larger communities. So that's a challenge. When you talked earlier, Tim, about staying ahead of the curve, when you can't test, you're not ahead of the curve. You need to hope that people really implement social distancing so that everything stays still in that moment of time until you can get going again. We've never had that challenge yet. We're continuing to be moving. We continue to test. We continue to quarantine. A question was about staffing. We are going to staff to the needs of the community, and that means getting more, as the health department trains more people to do different things, we will backfill those with part-time employees to do basic things that the health department has to do in other areas.
Is that what this map is? Is that a map of where people have come to the triage site for tests?
That map, I believe, is our map of positive cases where people live. The map next to it with the red, you'll see the red. All those counties on that have come to the triage testing site to get tested. Okay, one more question. We good? Thank you.